Councilwoman Lavette Fuller is here in studio.
Me and reminding you that there's that Shreveport Security Assistance message board on the Keel app.
Thank you. Oh man, you're doing not a bad job.
Look at me.
Not bad. Dr. Martha Whyte is joining us on the phone line this morning, and I want to thank you for joining us this early, as you have done since, gosh, 2 months now. Is it almost?
It seems like it. It seems longer, but I think that's all it is. So,
how are you? Happy Mother's Day, by the way, to you. I hope you had some time to kind of enjoy your motherhood yesterday, at least a little bit.
I did. My children were wonderful, as always. They're great kids. So, yes, I did. Thank you. I hope you did as well.
Definitely. We have the governor set to make an announcement today with regard to opening back up and ending his stay-at-home order. If you have a crystal ball, what are you anticipating? What do you expect to hear from the governor today?
Well, I do believe that it's going to be, we're going to have definite phases. I think people have asked me about hospital and nursing home visits, and I think those are going to be towards the last phase. As far as businesses, I do know that they're planning on putting out, a lot of guidance about what they need to do to be prepared to open. And I think that's important so that we can open in the best way possible to limit the spread of this disease.
What is your caution to folks as we do say that, we'll be able to open more businesses and more events that we like to go back to? What is your caution today as you look at that and listen to what is likely coming?
Well, my caution today is the same caution I had last time we spoke, and that's that we need to still take this very seriously. And I feel like there's a lot of people who have not been touched by this directly, and they don't quite get how serious this is. We're still having people die every day. We're still having people hospitalized every day. And it could be you tomorrow, to every person listening. It could be someone that they love tomorrow. So we need to take it seriously, because as we move out and about, we're all exposing ourselves a lot more. Everybody wants to latch on to conspiracy theories, and I really don't care about all of that. Mm-hmm. What I care about is the facts, that it's here, that people are getting sick and people are dying, and we need to take it seriously.
When you hear now it looks like the Trump administration is saying unemployment could reach the level of 20%. And then you hear others say that poverty kills more people than any virus ever did. And now we're plummeting our country into more and more impoverished people. How do you counter that argument, Dr. Whyte?
Well, I think that we don't want to do this forever, and that's not the plan. But if we do it too quickly, it's going to go on longer than if we do it slowly in the right way. And so it's not either or. You're going to have people who are going to get sick. We're going to reopen. It's how we do it and how we limit the effects of the virus. And, we don't have 80,000, 100,000 people die every year and from a virus. Mm-hmm. This is not a typical virus. And, we're lucky that it's not as virulent as SARS or MERS, because it's way more contagious than they were. So it is something that people need to open their eyes and realize that they're very likely to be affected by it.
Dr. Whyte, what is the latest on two things? One is herd immunity and the other is contact tracing. What can you tell us about those two things right now?
So herd immunity, that's our goal for every illness, right? We want as many of us to have had the disease, to have antibodies, and to protect ourselves as well as others. Just like we see with immunizations, we get antibodies from the shot, we protect not only ourselves but other people. But the problem is nobody has had this virus before, so we don't want everybody getting sick at once. The goal was to flatten the curve, to lower the curve and spread it out longer so that it was something where it was a virus that was something we could deal with. Now, as far as contact tracing, I think a lot of people have a fear of that. Really simply what that is us asking you who you've had prolonged contact with. That's not everybody that you spoke to. It's not everybody you ran into or even gave a hug to, but people that you really spent a good, 20, 30 minutes with in close contact, perhaps ate dinner with, across the table from, or sat in their home or rode in a car. Those are the people that we want to know about. And it's not to know your business, but it's really to protect those people. If you have the disease, we want to let them know, hey, you've been exposed. You could be exposing other people. Let's stay at home, watch yourself for the disease, and see, whether you're going to get it. So we limit the spread. If I can stop your contacts from going out and giving it to other people, I've done a huge service to the community.
Dr. Whyte, and this is from our Shreveport Security Systems message board, and it's a sounds like a silly, simple question, but help me with this because I hear it a lot, and I know you do too. If masks work, why can't businesses open? The masks either work or they don't.
It's not that the masks don't work. It's that people don't wear them correctly. People don't wear them uniformly, consistently. So, again, it's a matter of mitigating, not getting rid of, but limiting. So, if we know that cloth masks don't work as well as, hospital-grade masks, but it does a couple of things. It does limit the spread of your secretions, your droplets. It limits you from being infected by other people. Doesn't get rid of that chance completely, but it also reminds you that we are in the middle of something that we need to keep our distance. It reminds you to not touch everything. It's a constant reminder of the things that you need to do to protect yourself.
Dr. Martha Whyte, Regional Director, Office of Public Health, Region 7. Thank you, Dr. Whyte. As always, appreciate your time.
Anytime. Thank y'all.
You bet.